Mr. President.
Senator from Kansas.
Mr. President, thank you. It is such a privilege to be here on the United States Senate floor today on this occasion as we work our way through another set of appropriation bills. Today, the Defense Appropriation Bill and the bill we call Labor H involves the Department of Health and Human Services, which includes the National Institute for Health, NIH. And the senator from West Virginia was correct in her commentary in regard to this being a good day, but she was also correct in her commentary about the number of people, and especially the chairman of this subcommittee, Senator Blunt from Missouri, the ranking member of that subcommittee. I serve on this subcommittee, Senator Murray from Washington State, but I'm also pleased to be here with the senator from West Virginia, Senator Capito, and the senator from Maine, Senator Collins. It is an indication that there is broad support, and I now notice that the ranking member, the vice chairman of the committee, is with us as well, Senator Leahy from Vermont. And for as long as I've been in the United States Senate, and I've been a member of the Appropriations since that arrival, it's been a mission of mine to see that we increase the amount of funding for the National Institute of Health. And today we particularly highlight the consequences, the good things that happen in that regard with the diseases of the mind, Alzheimer's in particular. It is a devastating disease which places such an enormous burden on so many people, so many families across Kansas and around the country, and it has a huge impact on lives. There is currently more than 5 million Americans living with Alzheimer's, and their combined care costs us $259 billion to our healthcare system each year. I appreciate the opportunity to work on issues which combine the opportunity to help individuals, the care and compassion that comes from one's heart, to see that people's lives are improved, that families are changed as a result of the work. I also appreciate the opportunity to work on issues in which the mind kicks in which we can save significant dollars in our healthcare delivery system by finding the cure to Alzheimer's, delaying the onset of this horrific disease. It is estimated that by 2050, this number, this $259 billion to our healthcare system costs, could rise as high as 16 million people with Alzheimer's, from 5 million to 16 million, and carry the cost from that $259 billion to over $1 trillion. In fact, an individual develops Alzheimer's almost every single minute in our country. These predictions do not need to become a reality, and that's what this Appropriations Committee report that we will discuss, debate, and vote on this week involves. These astronomical costs can be curbed if this disease themselves are made treatable and curable. There's hope that progress is being made, and I'm hopeful, but I know that progress is being made. We've seen it. This past decade has brought a significantly increased awareness to Alzheimer's research, as well as important partnerships and developments at the National Alzheimer's Project that is updated on an annual basis. NIH researchers are now able to study an increased level of small images proteins, including detailed physical structures of the brain that are common in individuals suffering from Alzheimer's. And this new development could be that piece that links the research and data together to find a way to reverse the disease's impact on the human brain. What a wonderful development that would be. The only way to build on this progress is to solidify our commitment to supporting National Institute of Health through our annual funding increases. And again, I'm pleased to see that we are once again adding significant dollars to the NIH and particularly to NIA for this research. I'm a co-founder of the Senate NIH caucus, and I visited NIH headquarters last year with the director of the University of Kansas Alzheimer's Disease Center. It's one of 31 NIH-designated Alzheimer's disease centers across our country. The promising research that we see at home at the KU Alzheimer's Disease Center demonstrates the benefits of NIH utilizing partnerships to increase research capacity that yield results. It is critical to note that NIH's ability to support Alzheimer's research at academic institutions such as KU is dependent upon stable annual appropriations. That stable annual appropriation is also important for us to be able to attract the best and the brightest researchers in this country who need to know that there is a stable source of research dollars for them to continue their efforts at finding this cure and the delay of the onset. So many of us care for people who have been affected by Alzheimer's and serious illnesses. This unfortunate circumstance that many share should be made it easy to rally behind NIH in hopes of that cure and improving the lives of those we love. This is the fourth, excuse me for saying that. I'm proud to say that with this proposed increase of $425 million in fiscal year 19, we have now worked to nearly triple the funding for Alzheimer's disease research over the past years. In addition to our work in the appropriations process, there is a number of legislative efforts that are underway. I would mention two of them, the BOLD Act and PACHIA, which are legislative initiatives sponsored by many of us who are speaking today about Alzheimer's, that on the authorizing side, separate from the appropriations side, are deserving of the support of my colleagues here in the United States Senate, in the House of Representatives, and are bills that should be sent to the President of the United States for signature. But as a committee and as a Congress, we must work to provide the necessary support to NIH to discover, and we will continue to do that with this bill today. I also want to take a moment to recognize a couple of people. In my involvement in this issue, in fact, my involvement as a United States Senator in issues in general, you meet lots of interesting, caring people. But there is a family that I have met who, to the best of my knowledge, with nothing personally to gain from their efforts, Bob and Jill Thomas and brother Bill and Susan Thomas from Oklahoma have been relentless, tireless advocates on behalf of the Alzheimer's community. And it's so pleasing to me to know people who have a care and compassion for people and who spend their time and their resources making sure that members of Congress, the American people, and the Alzheimer's Association has the resources and information necessary to accomplish the goal that we're all about: a better life for more Americans and their families, the elimination of this disease that Americans now face, and the opportunity for us to find the cure to this horrific disease that affects so many. And so I want to use the moment to express my personal gratitude to Bob and Jill and to Bill and Susan and others across the country, others in Kansas, who day to day go to work to make certain that life is better for their fellow Americans and for people around the globe. Again, an honor to be here with my colleagues in support of this legislation, and I would ask there's many reasons to be supportive of the Labor Age Defense Bill, but I would highlight this one as one that my colleagues can rally around. Republicans and Democrats of all walks of life should be pleased by our efforts today to see that there is more research dollars available for that cure. Mr. President, I appreciate the opportunity to join my colleagues, and I now yield the floor to the senator from Maine, Senator Collins.